Question number 11. Quadratus lumborum muscle, which is the wrong statement. It fixes the last rib during inspiration. Unilateral action is it causes lateral flexion of the vertebral column. Bilateral action is it flexes the lumbar spine. It is supplied by ventral rami of T12 to L4 spinal nerves. Now this muscle quadratus lumborum, you know that this muscle is a muscle of posterior abdominal wall. So it arises from below and inserts above. The sites of origin about this muscle is, one is that it arises from the transverse process of L5 vertebrae, and there is this iliolumbar ligament like this. So it also arises from the iliolumbar ligament and also from the inner surface of the iliac crest, its posterior 1/3. This much. About the insertion thing, it is inserted onto the anterior surface of the transverse process of the upper 4 lumbar vertebrae on its lateral portion, because medially it's the origin of psoas major, you know that. And it also takes insertion here onto the medial half of the lower border of the 12th rib on its inner surface like this. So you've got to know about the origin and insertion. Now look about its muscle fibers. As you know, these muscle fibers will ascend up like this. This is how this muscle is. This muscle also forms the floor of many viscera, including the kidneys, sigmoid colon, ascending colon, descending colon, both the sides. So same pattern it will be on the opposite side as well. This is quadratus lumborum of both the sides. See the shape. This muscle is actually quadrangular in shape. That's why its name is quadratus lumborum. This muscle is innervated by the direct branches from the anterior primary rami of T12, L1, L2, L3 and L4. So the nerve supply is T12 to L4. Now think about its action. Like supposedly a person even sitting or having a pelvis fixed. So while inspiration actually it will, with the hold, it will, it will fix the 12th rib down. So while inhalation or inspiration, your diaphragm can contract smoothly for more effective contraction of the diaphragm. Now think about unilateral contraction. If a muscle on one side contracts, obviously this is going to tilt the lumbar spine to that side, causing lateral flexion. Now you know that this lumbar spine is like this, and here you have is the sacrum. So the pattern of muscle was like this, remember? Because you have a lumbar lordosis, like anterior convexity of the lumbar spine. So very important to understand this is when this muscle contracts, so what will happen? It will actually help in aggravating this lordosis. And in that way, it will help in extending the lumbar spine, or to make you sit up in an upright position on the chair. So its bilateral action helps to extend the lumbar spine. This lumborum, wrong statement. You got to know the answer is bilateral action. This is actually helping extension of the lumbar spine.